The impacts of inflation are making their way to the doctor's office. New data shows 47% of Americans find it difficult to cover healthcare costs, and a record number of people put off medical treatments last year because they could not afford it. Let's bring in Dr. Susannah Hills to talk more about this. She's a pediatric airway surgeon and an assistant professor of ENT at Columbia University Medical Center. Dr. Hills, good to see you. Happy New Year. So let's talk about this data. How many people delayed care, I guess, is the best question for you to kick this off. And who was most likely to put it off?
Yeah, well, this was data that we got from a recent Gallup poll that came out, and 30% of Americans in that poll reported delaying care, particularly because of concerns about cost. And what they found was people who were younger, who were less likely to be insured, women, and also people who had lower income were all in the group that were reporting delaying their healthcare due to concerns for cost.
Are you seeing what's in the data reflected in your own practice?
You know, I do often see families have trouble coming in when they are having challenges with childcare or in single parent homes. So yeah, these issues of finance, of not wanting to miss work, of having concerns about getting care for other kids who may be at home. These are themes that come up constantly. But I was really surprised to see that it was in fact this high of a percentage of Americans that were reporting this. And I was also really surprised to see that there were twice as many people this year that reported delaying concerns for serious health issues, or delaying care for serious health issues. So that was even more concerning, that people who have really, really serious health concerns or might be having an illness that really needs to be treated or delaying their health care.
So, I mean, let's talk about the real impacts of delaying medical care. I mean, in real terms and for real people who, because I think sometimes when we talk about these things, they can sort of seem far away. And oftentimes people even say to themselves, look, I will need to put this off because of the cost involved. But what are the serious medical risks that people face in doing that?
Yeah. So Vlad, it's just really important to understand that if there is a health concern that's ongoing, particularly one that you think might be serious, it's very unlikely that it's going to go away. So these kinds of issues tend to not go away or disappear, but they tend to escalate and continue to progress. And ultimately, it's going to have to be dealt with, but it might need to be dealt with, unfortunately, in the emergency room or in a scenario where you can no longer work and you can't provide for your family or take care of those kids, and you're going to be forced to take care of your own health concern. So if you can get ahead of it and address issues, or go to that preventive care visit so that you can be screened for those important things that can really cause serious health issues like breast cancer, like colon cancer screening. These things are really important to really try to do, because ultimately, if they're missed or ultimately there's a concern that's not addressed, it's only going to get worse.
And in the long run, cost you a lot more money than what you were you thought you were saving, you know? But I think also what people don't know sometimes is that there are options. What can people do when they need to see a doctor, but they think they just can't afford it?
Absolutely, there are options, right? There are often resources that people don't think of. If you have a kid in school, your school system will have a social worker who can likely give you a list of places that can provide free health care. There are ways in most states that you can access public hospitals or public clinics. Here in New York, it's the New York Health and Hospital System. If you contact them, you just find their number online. They have free clinics. They can give you the number to a free clinic, help set up an appointment. And of course, applying for Medicare is something that's really important to do, or Medicaid rather, it's something that's really important to do if you might qualify and if you're having trouble covering the costs of your health care, because that's a resource that is available to everybody who qualifies, and it can provide assistance for children in particular who may not be getting the health care they need due to cost concerns.
Dr. Susannah Hills, thanks for a very important reminder.
Thank you.